everyone, welcome to Osteobites. Thanks so much for taking the time to join us today. We will just give a couple seconds for everyone to get settled into our virtual room. My name is Christina Iptoma, and I am mom to Osteo Angel Dillon and Director of Scientific Programs at MIB Agents. And today on Osteobites, we are joined by Dr. Mo Yang from UT Southwestern. Dr. Yang will be introducing the development of the Osteosarcoma Explorer, a data commons with clinical, genomic, protein, and tissue imaging data for osteosarcoma research. Thank you so much, Dr. Yang, for joining us on Osteobites today. We are thrilled to have you. A little bit more about our guest today. Donghong, who is known as Mo Yang, is a researcher in the field of data science and health informatics. He's currently an assistant professor and a Texas Health Resources clinical scholar in the Quantitative Biomedical Research Center at Peter O'Donnell Jr. School of Public Health at UT Southwestern Medical Center. He also serves as the director of Biostatistics and Data Science Core at UT Southwestern. Dr. Yang's research focuses on developing methods, platforms, and infrastructure for the management, integration, and analysis of real-world healthcare data, including electronic health records, imaging, and molecular profiling data. He has led team efforts of building data commons, comprehensive database interfaced by user-friendly web portal for adult and childhood cancers and other diseases. He also applies advanced analytics to gain insights from these real-world data resources. So we're really looking forward to chatting with him today about the Osteosarcoma Explorer. Just a few announcements before we get started. Our annual Outbidding Osteosarcoma auction is live and bidding ends March 17th at 5 Eastern. Our incredible donors who make it better for kids with osteosarcoma have contributed generously, and we have some amazing items like one-of-a-kind paintings created collaboratively by HQ Osteo Warriors at our Factor 2023 conference in Atlanta. These paintings capture the essence of community, creativity, and shared passion, and will look great on your office wall. And you can score yourself a vacation at some incredible places like the Enchantment Resort in Sedona, Arizona, the Woodstock Inn and Resort in Vermont, the Castle Hotel Inn in Newport, Rhode Island, or if you are a city mouse, the Pier Hotel in Manhattan, New York. Or you could also just bid for 200,000 Delta miles and go wherever you want. Or if you're a thrill seeker, I'm looking at you, Dr. Yang, you can bid on a Daytona International Speedway experience where you can drive a Ferrari, Lamborghini, McLaren, or other amazing car at the 21st Annual Celebration Exotic Car Festival Daytona event on April 8th to 9th. And so if you need a little break today, you can go ahead on our auction site and explore some fun items. I'll put the link in the chat. For any clinicians and researchers, our next virtual tumor review board for osteosarcoma, which we call Turbo, is next Wednesday, March 20th at 5 Eastern. We have one spot left on the agenda, so if you have a case to present or you'd like to attend, you can just email me at christina@mibagents.org. And lastly, just a reminder that registration is open for our Factor conference, which is June 20th to 22nd in Cleveland this year. And Factor is really unique in that it brings together everyone in our osteosarcoma community, patients, caregivers, advocates, clinicians, researchers, industry, and funders. So if you're listening to this webinar, then you belong there. You will come to collaborate and you will leave re-energized and inspired. Scientific panels this year include how AI will impact clinical practice and research, targeting metastasis drivers, overcoming drug resistance, key pathways in osteosarcoma treatment, local control, preclinical models, immunotherapy approaches, clinical trials, and backed by popular demand, our patient panel. And Dr. Yang will also be there, and he will be presenting on our Creating an Osteosarcoma Atlas panel. So if you want to learn more about the Osteosarcoma Explorer and connect further, come to Factor because he will be there. Registration is $335 per person, and it's free for Osteo Warriors ages 8 to 22. We also have a limited number of travel awards, so if you're interested in those, applications are due March 29th. Okay, that is enough for me. Let's dig into the topic at hand, the Osteosarcoma Explorer. Dr. Yang, if you'd like to go ahead and start sharing your slides, let's get started.
Try to share my screen. Thank you very much, Christina, for the kind introduction. Can you all see my screen?
Yes, that looks great.
The full screen slides, and then this is the web browser, which I hopefully will use in
That's done well.
Okay, cool. Yeah, thank you again, Christina, especially for inviting me to this wonderful webinar series. Am I okay to start right now?
Yes, we are ready to go.
Okay, thank you all. Today, I think the main topic is to present and to introduce this project called Osteosarcoma Explorer, which is a data commons that we integrate clinical, genomic, protein, and tissue image data for osteosarcoma research. And before I start the actual presentation, I'd like to add a few acknowledgements and disclaimers. First, I want to thank all the funding supports for this project. This project is mainly supported through the Pediatric Cancer Data Core at UT Southwestern, which is a core facility supported by Cancer Prevention and Research Institute of Texas. We also received kind support from QualW Foundations and through their collaboration with COG, and also we have support from NIH. And I'd like to thank the whole team. The fact that I, as an individual, is presenting the work today here doesn't really mean this is far from something that an individual or even a few individuals can accomplish. So listed here are, as a team of researchers, we together contributed to the build of the OSE. These are also the co-authors of our recently published paper describing the osteosarcoma explorer. And obviously, we have people that not listed here who also contributed to the whole effort by different means. And I do recognize that we indeed have a much larger team, we can say, which is all the people who contributed to the data from the generation to the sharing of the data to so that we can have the data we work with today. So these includes the patients, their families, and care providers, and the researchers in this field. This is a group of people I think very well represented by organizations such as MIB agents. Personally, I also again want to thank Christina for your wonderful works. You've been doing for the organization, for the community. I'm very much impressed and blessed by your work. I believe you're a wonderful example of yet, one of all the people working for and working with MIB agents. I do have a few disclaimers. So first, I'm not a medical doctor by training. So the content presented today is intended for stimulating scientific research ideas and communications, and it should not be used as medical advice. And also, as a data scientist in this osteosarcoma explorer project, we try our best to accurately gather, harmonize, integrate, and present the data that are actually generated elsewhere by various teams and facilities. So as much as we make our best efforts to ensure the quality of our building process, unfortunately, I myself cannot answer all the questions regarding the quality or the interpretation of the source data we use in these projects. And with that, I believe we're good to start the actual introduction of this project. I'd like to start with describing a main challenge, I believe have been covered multiple times in this Osteobites series. That's in our biomedical and clinical research today. We have a siloed landscape of both the data sets and also the domain expertise who generates and who analyze and interpret these data sets. The whole siloed scenario can intensify for rare disease, which applies to most childhood cancers, including osteosarcoma. So this can be data from different types of sources and organizations, and this involve data of various different modalities and data types, from clinical or real-world EHR data to molecular characterization and imaging and some behavioral or social science. And this major challenge for our research today also becomes the motivation that we do this osteosarcoma Explorer project. In our field, we think a promising solution to the siloed data landscape I just described is what we call a data commons. So imagine what if we could gather and integrate all these different types of data generated by different entities and to form a viable platform where at the bottom level, it serves as a data repository, but more than that, what if we could further connect all these different data points, scattered data points surrounding each given patient so that surrounding the patient, we have the most comprehensive data points that we could gather, and then building on top of that to provide the end users, mainly the researchers in the field, an online access to the whole resource, and coupled with functions like a friendly web interface, data security assurance, and friendly data sharing mechanisms, and also some research driven functionalities like online analysis and visualization. So that's the whole idea of building a data commons where we can transform, these originally siloed resources into somewhat of a synergy for the research purpose. And at the minimum, this should be a place you can easily look up all the available data and biospecimens. And more than that, we have the potential to do advanced and additional functionalities based on that. And now, to the next slide. Down to this particular Osteosarcoma Explorer project, which we codename OSE. It originates as a flagship project built within the Pediatric Cancer Data Core, CPRIT-funded core facility at UT Southwestern, led by Dr. Yang Xie. And later, we were reached out by the QW COG office for sarcomas. So we were just discussing whether we can, there are already many data sets that were generated using the COG managed biospecimen. They also did some previous work in this high dimensional data platform. And whether we could gather and integrate these data and connect them through the patient identifiers, and then further combine with our local, EHR-based research data at UT Southwestern and Children's Health, which is the main focus for the pediatric cancer data core we have, and to build this data commons for osteosarcoma, and then to provide, the user interfacing part of this project would be a web browser, and for the users to navigate this data source. And we're glad to see that today this web portal itself has been released to the public domain. So you're very welcome to give it a try. You can either scan the code here or type in the URL and you can try it on your end. The next, I want to go a little bit deeper into what's behind the OSE project. This is a summary table for the data sets we so far have collected for the phase 1 of this project. These includes the target data sets, which is the clinical annotations and genomic profiling of over 300 patients through the target osteosarcoma project. These are data generated based on the tissues collected through the COG studies. And then I mentioned we have a previous work on the HD data set through the QW COG sarcomas office. These are data for 164 patients. The highlight of this data set is, in addition to the clinical annotations, we have a HER2 protein expression available for these patients. And then we further worked with data from a published work by Doctors David Shulman and Brian Crompton and others from Dana-Farber Cancer Institute. I believe both of them are recent OsteoBytes guests. And this data includes circulating DNA, circulating tumor DNA data for 72 osteosarcoma patients. And then As I said, we have locally our EHR-based data collected from Children's Health and UT Southwestern. We have data for currently 50 osteosarcoma patients with more than 700 high-resolution H&E pathology images available. So as a whole, we have so far collected almost 600 patients with this comprehensive landscape of different types of data elements. You can see the details about these data in our recently published paper on Osteosarcoma Explorer. And I wanted to emphasize that this is the phase one of the whole project where we lay out a foundational framework to prove that we are able to incorporate and integrate these different data modalities from different sources in a meaningful, viable way of a data commons. And then next, we could do more to build on this and to expand on this, which I will discuss at the end of this talk. And to fully build the data commons, the first step we would do is to design what we call a concept map, as I show here on this slide. What a concept map here is a summary of the typical clinical workflow in osteosarcoma patient care. And we can see here from all the way from the initial diagnosis to the potential treatments, procedures, collection of samples, and evaluation of the treatments, and then all the way to the follow-up. And we can differentiate the different elements or steps in this process by those actions taken by the care providers, which is these red edged boxes here, and also the results or observations, which are these green edged boxes here. And then we need to translate this real-world series of actions and observations into a structured data elements, what we call in technical term a data model for the purpose of building a database. So these yellow filled boxes are so far the structured data elements we have included in the current version of the Osteosarcoma Explorer data model. This is a very essential step because here we connect the domain expertise from our clinicians and the data engineers and data scientists. And we could potentially further grow this diagram to incorporate, more data elements that's related to osteosarcoma care or research. Now we have looked at the big picture of how to initiate a data model for the meaningful database. Next is another important aspect of designing of our data model, and this is about the terminology harmonization. You may imagine it's very common to see that data recorded, generated by different sources, they are encoded or they're recorded in very different format or terminologies, or sometimes even non-structured terminologies. When we talk about terminology, this is different ways of, for example, calling a medical concept or different granularities you can leverage to describe an observation or an event, or sometimes as simple as how you spell your spelling conventions of some values and subjects. In other words, these data in their original states, they speak different languages. And what we're trying to do here is to review all these original terminologies and consult with our clinician investigators, and then to derive a comprehensive standardized terminology that can cover all these original languages. And to avoid reinventing the wheel, our central terminology system are all also mapped and bridged onto public standards. For example, here we map them onto the NCI concept unique identifiers so that they can be further used for interoperability uses. And then with this on top of our data model, we're ready to basically translate, you may say, those different original terminology systems into a uniform one. Now, to summarize the whole process I just talked about, this is what we call an extract, transform, and load, the ETL workflow for transforming the original raw data sets, which were structured differently, which speaks different terminologies, but we transform them, conform them to the OSE central data model. And so that the different pieces of original data shown by these different colors, they can find their own place in our comprehensive data model, and then they can always be expressed, presented in a uniform terminology. Some other key steps involved in this whole process includes, very importantly, ID matching where applicable. For example, all those COG related samples and COG enrolled patients, we hope to, through this process, to connect the different data points onto the same patients if possible. And also this involves a transformation of the data structure, some basic cleaning and curation of the data, standardization of the terminology, and also we want to build some infrastructure to ensure the quality of the whole process, so that whenever we have a new or refreshed, updated source data, or sometimes if we want to modify this data model, we can repeat the whole process in a viable way. Okay, I hope you're not too bored with all the behind scenes, and now I think it's time to introduce or navigate through the web interface, which is what we as end users can use on our daily research works.
Yeah. Dr. Yang,
Christina,
before you move on, which I know we are super eager to do to get into the interface, but just a couple questions. So on the concept unique identifiers, so because you are using, these are NCI unique identifiers, that it really is kind of an industry standard and things that other data commons are using as well, like genomic data commons or the pediatric cancer data commons. Is that correct? So it's really, kind of the same standards that are used across other commons.
Yes, they're interconnected. Yeah.
And for some of the data elements that you mentioned in that really nice kind of mapping that you had, yes. I'm just curious, like how automated or manual is some of this? Because my understanding from, depending on what types of records they are, if they are especially like clinical records, that a lot of times information like this might be kind of more written in notes as opposed to, like an actual data field. And so I'm just curious, like how the extraction of that data, how automated or manual is that for you to be able to kind of map it to these different data elements?
And that's a great question. Actually, that's a really scenario we face day in, day out. And I have to say, fortunately for the phase 1 project, we have so many great data contributors, and these data, most of them are pre-annotated by some clinicians, experts in this realm. But that's what I'm going to cover in the very almost final slides when we talk about future directions, because exactly like you said, if we want to go deeper integration with the EHR data, that's something we have to solve. And we do have some, we think, promising vehicles that can help with that. And I'm going to introduce that later if that's okay.
Oh yeah. Okay,
But
great. Thank you.
yes, this depends on a lot of clinician and researchers work on almost manually read through from the notes and in the current day state. Yeah.
Great. Well, I won't delay you any further from jumping into the interface.
Okay, great. Thank you. Stop me anytime if any questions pops up. Here I'd like to, instead of these frozen screenshots, if my internet allows, I'd like to do some live demo. Can you see my web browser?
Yes.
Okay, cool. So this is what is live today as the Osteosarcoma Explorer. The front page is simply some overall information I just described. The data page you can interact with is this query patients, or what we call the cohort formation, cohort discovery function. What we can have from here is that you can navigate through the data by going through these different handles or filters where that can help you focus on, narrow down to the patients, to the groups that you are interested in for your research. For example, here, when we select, we want to have the data covered by both HCD and target. For example, maybe we want to focus for this study on those patient diagnosed without metastasis at initial diagnosis. You can see this number funnel down to the final cohort we have. And from here, you have a overall description summary of some key demographic factors, and also here the HER2 protein expression status for the cohort you just selected. And down below here is a data table where can show you the precise list of data records for the patients we have just selected. And from here, we may want to look at individual patient records, and that leads us to the patient dashboard we built, which you can go inside by clicking on any of the patient IDs selected from the previous step. Starting from this step, we require, because this is individual patient level data, we require an account with us and a login. So let me quickly log in here. Okay, let me pull back this browser. I do still remember my password, so I'm now in. This is for the patient we just selected, some basic demographic and diagnosis information. Down here, we can see the treatments the patient had received. And again, the HER2 protein expression and HER2 mRNA expression and copy number variation. Further down here, we have a chart summarizing the whole landscape of copy number variation for the same patients. And then based on the target genomic profiling data, we can have more detailed information about, for example, the genes with a somatic mutation and copy number variation status, things like that. So here I have just demoed the individual patient dashboard function, so you can have a deeper view of a given patient. Now I want to jump back to that front page. I want to introduce you to another function we may have. Let me first unselect all these patients. We provide an online viewer for all the images we may include in the platform. For example, here from our local UT Southwestern data, we tried to include some representative pathology images. Let me open up this one example for the high resolution image. From here, what you can see basically is all the slides that are available for the selected patients. Depending on my internet speed, I may go across these to show you the different available images. And if you click on one image, again, subject to internet speed, you may be able to very smoothly go down to the cellular level information from this image. So we found this is a functionality of high demand, and we provide that through our portal. I believe that the next set of functions I like to show is some various online analysis modules we provide. Basically, we allow the users to do some straightforward survival analysis based on the different types of variables. Let me quickly show that. If you click on here, the perform analysis page, here we will have the options to do some online survival analysis. For example, this is based on the gender, and you could flip that to other potential variables. and the overall survival, or you can choose the event-free survival, and the chart will update. Another example, if you are interested in doing survival based on certain gene expression, let me enter. You can select the gene symbol here and run analysis. This will give you, based on that gene expression, what is the survival looks like. And similarly, for example, I mentioned about the ctDNA data kindly provided by Dr. Crompton's lab. This is based on their published work, the survival based on their circulating tumor DNA status. In addition to this, we have integrated a local build, a local instance of the CBio portal platform. This is a platform that's also widely used by the research community. Here, we built this platform based on the same curated, harmonized data set I have just described. And from here, you have more functions available to build charts and graphs, different ways of describing the same data set. And if you focus on, again, one single gene, I'm going to use this example again, you can have more detailed view using their built-in OncoPrint functionality. Or, for example, if you want to do some plots, I believe here you can choose to do associations between the variables of your choice. Similarly, some co-expression plots that can be done for different genes. With the time constraint, I'm going to just show these very quickly, these different options of analysis and data visualization you could do with the Osteosarcoma Explorer. And if I may, I can address a little bit on, I have shown you the main functions through our portal, but as a project, we also want to provide decent user support. As I mentioned, currently we require users for accessing individual patient level data. We require users to have an account with us. Subjected to our discussion and some regulatory concerns with considerations with the COG and our home institution. We are now only opening the auto registration to certain research and educational organizations, mainly in North America. It might be the case that your email domain is not yet covered by this mechanism. In that case, you are welcome to email us, and we can register. We can open up an account for you on a case-by-case basis. Talking about user accounts, I'd like to say that, gladly say that we have accumulated more than 80 registered users across many different continents. We, from time to time, receive requests from another country, another continent, to say they are interested in using this portal. For example, this I just screenshotted just an email received a couple of weeks ago from a researcher in Brazil. I believe Osteosarcoma helped not only their research efforts, but also some sort of educational effort. They mentioned here, my course conclusion work involves Osteosarcoma, and OSE helped me a lot. We're really glad to hear stories like this. And we so far have accumulated more than 100 site visits per month. Let me flip back a little bit to the user support function. As I described, you may realize it takes time and efforts to fully integrate a new data set into this framework. But apart from that, we also want to provide OIC open to other types of support to the user. For example, we could use OIC as a data sharing hub. Here's an example. For a individual research project led by Dr. Libe at UT Southwestern, we use OIC as the public-facing portal to house their data. That's according to the requirement of the journal they publish in. And we see this an opportunity to, for different individual projects to, be able to uh, publicize their data sets available for the osteosarcoma research as a whole community. And to address on the OIC impact, we so far have been featured on the Childhood Cancer Data Initiative in their data catalog. Also, thanks to Christina, your coordination in that process, and also we're featured by Osteosarcoma Institute and obviously by MIB agents. And again, this is our publication on this particular work. Now we're here for the final, the future directions. I mentioned that there are a lot of opportunities to further build a phase 2 or version 2 of the Osteosarcoma Explorer. For example, we can consider new data sources. I mentioned about potential deeper integration with the real-world EHR data starting from UT Southwestern and Children's Health in Dallas. We also have gone through regulatory requirement paperwork with COG in terms of getting pathology images for all those COG managed osteosarcoma biospecimens, so we can utilize our image viewer function to build on those image data. And we realize for basic research and translational research is sometimes very important to have data from the patient-derived xenograft. We have successful example of doing PDX modules for other explorers we built, so we could potentially expand Osteosarcoma Explorer towards that end. And now talking about all the new technologies that potentially can facilitate and even automate the process of this, very labor-intensive data extraction and data reviewing process for building the Osteosarcoma Explorer. This comes back to Christina's original question. We realize large language models nowadays, for example, ChatGPT can very capable of extracting data from in this setting, mostly the free text, the medical notes and reports. Actually, our team, we have just had a new paper accepted by MPJ Digital Medicine, just evaluating ChatGPT on precisely that purpose. And I quote from this unpublished manuscript here that in this work, we indeed utilized the 191 real-world osteosarcoma pathology reports, which we acquired from UT Southwestern and Children's Health. And here we found that ChatGPT can actually very accurately classify both the grades and the margin status information from those, doctor-written medical notes at a very high accuracy. So we do see a potential to better utilize these novel technologies to facilitate the whole process, and we're very interested in that direction. And talking about some new collaborations on what I mentioned as a data sharing hub, there are ongoing discussions with Quad W Foundation and also with MIB agents. We hope to form further synergy on that end. Before I end my talk, please let me give you slightly bigger picture of the more like the home base the OIC project is in. As you may already realize, OIC itself is part of a bigger universe. And this is rooted in the Pediatric Cancer Data Core, a core facility supported by CPRIT and directed by Dr. Yang Xie, who is also my mentor and also the leading figure in the development of the OIC project. And what we're trying to do here is to build a common, comprehensive data commons for all types of childhood cancer, and to facilitate the process of data integration, harmonization, data management and sharing, and all the way to some end user functionalities like online analysis, cohort formation, and visualization. And let me show you very quickly in this last slide the progress we so far have. We have gathered all these individual projects like Osteosarcoma Explorer into a bigger umbrella project, what we call named Childhood Cancer Explorer, the CCE. You can see here we have much more data available, mostly gathered through our local institutions through the Pediatric Cancer Data Core facility. Osteosarcoma is one of the first successful examples, and we're now building, and we have built and in the process of building many more new explorers for different types of disease or use case for childhood cancer. Okay, and with that, I think I'd like to go back to my acknowledgments again. Appreciation for these funding supports who made this work happen, and the whole team who contributed to the process, especially our senior authors in this paper, Dr. Crompton, who helped initiated and coordinated our collaboration with QualW and COG, and Dr. Yang Xie, who lead the whole project. And again, the biggest thanks to the whole community, including the patients and their families and care providers and researchers, without whom this is not possible at all. And with that, I think I'm open to any further questions, comments, and suggestions. And thank you very much for your attention today.
Thanks so much, Dr. Yang, for a great presentation. And also just want to congratulate you on just a very kind of elegant solution to definitely a kind of a big need, I think, in our space. And I actually just shared a link in the chat to an article that Jillian Okamoto, who, believe it or not, she's only 17, but she's an osteo warrior and on our junior advisory board. And she actually just published an opinion piece in Newsweek about the issue of siloed data and, how it's harder to, get to discovery and accelerate discovery when data is kind of siloed and that we can't really start to see patterns from that. So it's definitely a pressing need, and really appreciate all your efforts and your team's efforts to solve that in a really nice way. Anyone, please feel free to add any questions to the Q&A, and just to maybe kick us off with just some questions about the data. So I think you had alluded to the Children's Oncology Group, the COG unique specimen identifiers to be able to identify patients and then perhaps like connect data across groups. And I'm curious, across the 4 data sets that you're currently pulling from, how many patients were matched? And then is it possible that if patients were not coming from that COG data group, is it possible that there might be patient samples in here that are not matched?
That's a great question. We indeed hope for match as many as possible, but through that centralized the COG identifier system, we do match to a certain degree. Now, obviously, not top of my head, I cannot have the numbers, but in our paper, I think we address the overlap, the patient between these sources. Now, on my back end, I'm pulling up this paper right now. I believe we have sort of minorities. We have about 7 patients overlapped between the HDD dataset and the target dataset. We have another 6 patients between the target and the Dana-Farber dataset from Dr. Crompton's lab. So minority or smaller fraction of the whole group were able to map. Yeah, for now.
And the other thing I understand is that longitudinal data across time for the same patient is a little bit of a unicorn. And I'm curious if there's any longitudinal data included in these data sets.
That's really a great question. I do think for the current general clinical annotation, they do, for some variables, they do have some time aspects within the variables, but mostly these are still flattened tables, we may say. But when we mine, I don't know if I've shown here, but when we mine these EHR data from our local institution, those 50 patients, we do have very rich time-dependent or longitudinal data available. For example, even for the, I believe for the images, we do have images from the two major time points, the two different time points. I believe for most patients, we have um, initial diagnosis and after treatment time points for the pathologic annotations and the pathology images available.
Okay, cool. And there are obviously huge benefits to this because it is so disease specific. But for those who aren't as familiar with kind of each of the different commons and some of the different visualization platforms, can you talk a little bit about just kind of the differences of what someone might be able to access with Osteosarcoma Explorer versus some? I mean, it's actually super cool. I didn't realize you had that integration with CBio Portal, which really kind of opens up so much, different types of questions that you can get an answer to. But for some of the existing commons, like, there's the Genomic Data Commons, for example, or I understand CCDI is working on a childhood cancer clinical data commons. And of course, there's a pediatric cancer data commons. And then there's, St. Jude Cloud, there's Kids First. So there are some different, and there's little bits, again, it's part of the issue. It's like a little bit siloed, but there's little bits of osteosarcoma data sitting in kind of each of those. But kind of just differences, or it's just how you would differentiate OSE from some of these other platforms.
Yeah. I would say yes. I really think that all these different examples you mentioned are very important projects in the whole field to facilitate the data empowered research. Um, if I'm correct, I think Osteosarcoma Explorer itself is the first project that's focused on osteosarcoma. So we intendedly gather data for osteosarcoma and all those works that we mentioned about connecting through the patient identifiers so that we can have as much as possible data elements for each given patient. Those things, and then our front end cohort discovery and some data visualization are built upon that already integrated and connected data resource. I think that's one of our highlights compared to, for some other project, although I very much think recognize the value in there, but still tends to have, isolated, separated data sets within the platform, with not necessarily can connect together, especially through an online visualization point of view. And also another signature for the current project, at least for the phase 1, is that these are many of these data have molecular characterization data available, of course, through the COG studies. It is almost another world when now we want to enter into a deeper integration with EHR data, with other real world data sources. And I think some of the projects you mentioned also have their strength in working on real world observations, working on EHR data. I think, and that's also something we're very interested in doing. Yeah, but yes, in short, I think osteosarcoma, it's first data commons project, comprehensive data commons that focus on osteosarcoma and research data sets.
Yeah. And as you start to think about expanding the project to incorporate new data sources and like EHR, for example, how are you prioritizing what data sets to add to OSE? Because I imagine it's a pretty heavy lift to incorporate some of these data sets. So I guess kind of what, and I kind of asked that too in the context of any scientists who might have data sets who are working on studies and would like to share that here, kind of how would you prioritize and kind of what are your criteria for adding data sets?
Yeah, that's another very insightful question. So, basically, in our strategy, we can consider the whole expansion process as more like a table, which it has its length dimension, it has its width dimension. When I say the length dimension is basically you're adding more and more data records for the, maybe existing structure you already have. You're adding more patients, more samples, images into this. Let me show already formed structure of the database. The width dimension is more like on top of this, we want to expand onto other modalities that can, form a better synergy for the whole picture view of the data. For example, the PDX modality, the NLP, the natural language processing, the inclusion of notes and inclusion of, for example, medical radiology images, things like that. Those applies to the width axis width dimension of the whole project. So to answer your question, I think over the length dimension, we want to have all those easily accessible. Of course, when I say easily, it's not easy at all, but relatively easier accessible data sets, especially, for example, from our home institute. We could potentially add up those data sets relatively quickly. Well, in order to get EHR data from other institutions, there can be a lot of works involved in between. Now, to the width dimension I talked about, I think it really, if some investigators can share their data that's generated in other modalities, or their PDX arm of data, those I think we can readily start. Once the data is ready, we can readily start on expanding and designing a new version of the data model so that we can include those. So in short, we need to definitely start from the lower hanging fruits, and while we also think what is the trends in the whole research domain, all those new powerful data generation modalities, for example, spatial genomics, profiling, things like that. Yeah.
Got it. And so you touched a little bit about some of the upcoming initiatives like including EHR and being able to process pathology notes. And you talked a little bit about incorporating the PDX data component, but could you maybe expand on that a little bit more on kind of the idea of that and plans for that?
Oh, yes, definitely. Yeah, I should have some backup slides for specifically the PDX part. Your question was surrounding the PDX arm, right?
That's right.
Yeah. So for some other project, actually, I leave it here for another project in collaboration with UT Health San Antonio researchers. We built a PDX Explorer, which the focus is on, connecting patient-derived tissues and patient-derived xenograft tissues and the data generated from both types of tissues and in a viable database. And from there, it involves another set of data model or concept map design, so that we have a all-inclusive connectedness all the way from patient to samples and to the PDX. And that proves to work really well. Actually, that PDX Explorer is now in production mode, and it allows even users to, from their laboratory, to direct add and modify updates, real-time sample management information directly into the portal, into the database. We found it's very useful. So that whole block of data structure design can be, added onto osteosarcoma as more like a plug-in and play kind of fashion. Say if we have a group who does have the osteosarcoma PDX data available, we could discuss, how to add it on and expand the current database.
That is really cool, and that's cool that you already have that pediatric PDX Explorer in production. So you mentioned using machine learning to be able to better read the notes and basically make sense of that and kind of extract data that way. And I'm curious just kind of what your thoughts are, because I know this is really, you're basically kind of collecting the data all in one place and kind of creating this really nice visualization platform for people to be able to easily access that data. But I'm also curious because, if you look forward a few years and you are able to then start creating kind of a larger data set and kind of connecting the dots across those data sets, then there's a possibility to start actually kind of seeing more patterns. And so kind of your thoughts on leveraging machine learning to be able to then kind of dive in here and start to kind of see more patterns and perhaps, predictive modeling.
Yeah, I think that's a really big question.
Mm.
Obviously beyond what I as an individual can address it wholly, but yes, so we do think the way AI works nowadays still like the emerging ChatGPT like large language models can have shown very much promise in extracting existing data, right? But it's really how that can further be expanded and used in the process of generating or gathering data. I think that's really a big trend that worth more investigation into. For example, all the way from the clinic, the bedside, the clinic end. When the doctors needs to enter data, can we just start from the AI to leverage that data entering, data collection, and generating process? I think your question is mainly also about how this can further be applied to really analyzing the patterns inside the data, not only the data itself, but potentially also the data quality measures from different sources. That's also something that's people have been doing on individual data set, but yes, as a whole data resource, how AI can work and how to utilize AI. I think it's just a very open question we all want to see and we all want to participate in doing our research in. Yeah.
Yeah, I mean, there's so much potential, like, because even just looking at the H&E slides, but even like potentially imaging, you can imagine. I don't know if that's an area that you're looking into as well, radiographic imaging.
Yes, I didn't obviously include due to the scope of this talk, but one of our co-authors, also a professor in our institution, Dr. Guanghua Andy Xiao, and his team do also very fascinating AI-driven works on the osteosarcoma. Actually, many types of pathology images, but specifically for the osteosarcoma. They also do the similar AI, image feature extraction, and that can lead all the way to outcome prediction and tumor classification subjects like that. Yes, the team itself is really we are combining very diverse expertise in order to make it happen. And we do have some work, I believe, in prototype mode that can remember what I show as the image viewer here, but can allow even more advanced AI assisted image annotation and image recognition functions online right inside the browser. So exactly what you're thinking, I think it's happening, and it's happening in my setting also. Yeah.
That's amazing. Well, I'm so happy that there are brilliant people like you working on this problem. Oh, wait, I think we may just have one question come in. Oh, yep. Let's get this question in. As the project evolves to the Children's Cancer Explorer, it is believed that there could be value in mixing and matching among all the data sets to gain insights. Is it believed? And if so, will that capability be a feature of the portal?
Yes, what I hear is really a affirmation of what the direction we're going. But could you repeat the question part? I probably missed what is the exact question?
Oh, yes. So as the project evolves to the Children's Cancer Explorer, is it believed that there could be value in mixing and matching among all the data sets to gain insights? And if so, will that capability be a feature of the portal? And I think maybe what that question might be getting to, for example, is you have different disease groups like osteo and rhabdo, germ cell, and perhaps, there might be some questions that kind of cross diseases like, you know, uh,
That's a wonderful.
signatures or something like that. So is there maybe the ability to kind of look across those data sets in the CCE?
Yes, definitely. That's a wonderful question. I think that's also one of our deepest motivations of why to gather data even from diverse type of childhood cancers together to build this resource. Obviously, for each single data disease type or even the subtypes of disease, the biological and medical backgrounds and contexts can be very different, which not necessarily can, realize what we think when we cross the data together. But for some particular subjects, we already see the value of doing this in a combined way. For example, we talked about image recognition tasks from this medical image. We realize although for example, the pathology features, histological features for different diseases can be different, but the foundational process of recognizing these features can be, applied across different diseases. So when we have so many images available for different types of images, that is itself is a very powerful resource for training and optimizing the next generation of the AI tools we can use. That's just one example. I believe similar things can happen to molecular characterization. And also we see that happening to large language models, right? When we can feed, data from different types of disease, but in addition to that, different types of personnel involved in the care journey, for example, clinicians, social workers, nurses, there are different writing skills, there are different emphasis in their writing, and to group all these together and to realize a better language processing capability, we see that it's very promising. So yes, we do see a great value in connecting even the different types of cancers together in this CCE effort.
Wonderful. Thank you so much for sharing this fantastic resource, Dr. Yang. I mean, I really do think it's a game changer that kind of maximizes the value of all the research that's already been done and kind of all the research that's to come. So it's really kind of like a tide that's kind of lifting all boats. So thank you and your team for all your work on this. And thank you for joining us on OsteoBytes today and making it better for osteosarcoma patients. More information on this and all OsteoBytes can be found on the MIB Agents YouTube channel, on our website at mibagents.org, and at your favorite podcast place. And next Thursday on March 21st, we are dropping a new episode of our AYA podcast, Osteo. Osteo Warriors Camille and Mia spill the tea on living with cancer as an AYA. And they're going to be joined by some other Osteo Warriors to discuss their personal experiences with different types of procedures to remove lung metastasis. And then we'll be returning to OsteoBytes on March 28th. We're going to be joined by Dr. Damon Reed. He's the division head of pediatric solid tumors and chief of the Pediatric Sarcoma Service at Memorial Sloan Kettering Cancer Center. He is also the vice chair of the Bone Tumor Committee at the Children's Oncology Group, and he will be joining us to discuss the recently published COG 2023 Blueprint for Research on Bone Tumors. So it's actually a really nice follow-up to this conversation today. You can find our OsteoBytes lineup for the next few months on our website. And if you have any ideas for future topics that you'd like to hear about, please feel free to email us at events@mibagents.org. Thank you again, Dr. Yang, for spending an hour with us today. We hope to see everyone back here on Osteobites on March 28th when we talk to Dr. Reed about the COG 2023 blueprint for bone tumors. Thanks, everyone. Thanks so much, Dr. Yang. Really appreciate it.